Hello, everybody. Welcome to Medicine and Science on the Pod TV network. I'm Nick Pellavita. I'll be your moderator for today's show. And today's show, we're going to feature something really exciting. In the United States, is your health in danger? And what I'm saying is, we've got some serious problems with attacks on the CDC, attacks on the NIH. And frankly, it looks like the person who's running the ship has no experience in medicine whatsoever. So the real question is, what do you do? Are your kids going to be infected? Are you going to be infected? Are more people going to die? So with that, rather than talk to a person in Washington, D.C., who's a lawyer who has no medical background, on the Pod TV network, when it comes to medicine, we talk to a doctor who has a medical degree and is board certified in internal medicine, a little bit better than an environmental lawyer in Washington, D.C. And that doctor is, of course, Dr. Michael Patmos. Dr. Michael Patmos, welcome to Medicine and Science, and hopefully we'll get to listen to a doctor discussing medicine as opposed to a lawyer in Washington, D.C. So tell us what's going on with this new crazy revolution where lawyers are now all of a sudden practicing medicine. What's your thoughts?
Well, good morning, Nick. Good morning to the audience. Again, thank you for the privilege of spending a few minutes with you. Not only do we have unqualified people like Robert F. Kennedy heading up Health and Human Services, but this whole issue of what qualifications are appropriate has been really all through the whole COVID situation. I've made a point of this many, many times on this podcast and also in my posts on LinkedIn and elsewhere, that we're now living in a time where physicians who don't have training in a specific area feel perfectly comfortable giving out advice as experts in areas which they're not trained. Let me give you an example. We have doctors who are not board certified or trained in infectious diseases who are opining as experts about COVID and about vaccination. And I think about that for a second. If you wanted to get the latest information or the best information about cancer for a family member, would you go to an oncologist or would you go to a doctor who wasn't trained in oncology? If you wanted information about cardiology, would you go to a cardiologist or would you go to a doctor who wasn't trained in cardiology? Yet, when it comes to infectious diseases, people are turning to non-infectious disease doctors instead of getting the advice from doctors who are actually trained in it. So we not only see lawyers opining as experts on medical topics, we see doctors going outside their area of training. Now, they can't do that in a hospital because in a hospital, your privileges are restricted to your area of expertise. Cardiologists can't practice infectious diseases, and oncologists can't do surgery. I mean, you have privileges based upon your education, but out in the public sphere, pretty much anybody can claim to be anything they want, and we now see doctors with no training at all in infectious diseases opining as experts. So it's a big problem. Kennedy's a problem because he has no training in medicine or biology at all, and his ideas are completely nonsensical when it comes to, he doesn't even believe in germ theory. He doesn't believe that bacteria and viruses cause infections. He thinks that it's really the environment and the genetics that make you sick, that the infection is unrelated. So he doesn't even believe in germ. This is something that goes back to Pasteur, the 1800s. Kennedy doesn't even believe in basic biology. So you've asked the question, is your health at risk? Well, rather than my telling you if your health is at risk, I thought what I would do today is tell you what we've done and then give you some of the current data hot off the press as of this morning, and then let the viewers decide for themselves if they think their health is at risk. So here are some of the things that have happened in the last month since Trump was inaugurated. The CDC, the Center for Disease Control, the premier disease detective entity in the world, has been gutted. Over 10% of CDC employees have been fired, and most of those came from the early disease surveillance capacity. So we have all these disease detectives at CDC. They're now gone. We have seen a major impact on medical research. Medical research funding, indirect costs, and so forth have been under attack. Most medical schools, universities that do medical research are panicked and don't know what they're going to do. Ongoing research studies have been canceled. Patients have been impacted in that regard. Data is missing. When the CDC was gutted, they also shut down much of the data that you could access from CDC. Some of that has been restored, but there's tons of data sets that are missing. So there's data about health surveillance and disease surveillance that we don't have now. The CDC communicates with doctors regularly every week in a report called the Morbidity and Mortality Weekly Report. I have relied on that report as a doctor for nearly half a century. That report was stopped and was unavailable. I don't think it's been put back up yet. And we rely on that to tell us what is happening where. So right now we have a real problem with getting data about what infections are occurring in what locations. The CDC used to provide data, really very granular data by zip code. So if you want to know, is there TB in your neighborhood, you just go on the CDC website, it tells you. Now all of that data is missing or corrupted or not updated. It's really making it hard for doctors to know what's happening in their neighborhood. So and then of course NIH is being gutted, and the research focus of NIH is being changed. So across the board, the entire public health infrastructure is under attack. People are being fired. Agencies are being essentially wiped out. Data is wiped out, and the communications from those agencies have been interrupted and also altered. Now, for example, there's a banner on the CDC website that says that there's an immutable biological fact that there's only two sexes, and everybody else, you're just, out of luck. So if you have Klinefelter syndrome or Turner's or Kallman syndrome or ovotesticular disorder or 5-alpha reductase deficiency or any of the other myriad of intersex states, you just don't exist anymore. So that's kind of things that are happening. But what data is there that's actually having an impact? Those are things that have been done that are potentially dangerous. But the cynic might say, well, what has really happened as a result of that? Well, here's what happened. Last week in the United States, 4% of all deaths in the United States last week were due to the flu. Influenza is back, and we're having the worst year in 15 years with influenza. Why? Because influenza immunization rates have dropped dramatically. So we're now seeing the worst flu year in 15 years all around the country now. Thousands of people are hospitalized, and 4% of all deaths in the United States last week were from influenza. What about avian flu, an even worse one, H5N1? Well, now there are cases in Nevada, Wyoming, and Ohio. That is spreading. Now, that one is bad because that one, H5N1, has a much higher mortality rate than regular H1N1, regular influenza. How about measles? Measles, now we have over 50 reported cases in Texas, New Mexico, Georgia, and New Jersey. Now, here's something that's not been reported in the media, but I suggested this a few months ago on this podcast, that, remember there was a measles outbreak in Florida, and all the infectious disease experts in the world would tell you, if your child was exposed, you put them under quarantine. Well, the state surgeon general, Joseph Ladapo, in Florida said, don't worry about that. If your kid was exposed to measles, it's okay. Let him go to school. Well, the problem with that is if they're incubating measles, they're going to infect 18 other people. Each person with measles exposes 18 others. So it's a logarithmic expansion. And then a bunch of people in Florida traveled outside of Florida and inoculated neighboring southeast states with measles. So my speculation is that the cases in Georgia, Texas, New Mexico may in fact have been a spillover from the cases in Florida from last fall and last summer. With measles, there's over 50 cases now reported. You have to remember, most cases will not be reported. Parents may see a child with a rash and a fever, and They don't know what it is. They don't take their children in. Or they go to the doctor and the doctor doesn't recognize it as measles. They might think it's a rash from taking an antibiotic or something. So just because you see there's 50 reported cases, there's actually many more. It's a small percentage of cases that actually get correctly diagnosed, documented, and reported. So there's really there's many more than 50 cases, I assure you. So measles is spreading. How about pertussis? Pertussis is up 170% all across the United States. And with measles, just to put it in perspective, last year in the United States, we had 188 documented cases of measles. That's 3 times higher than it was the year before. I think we're going 2025. We're already way over 50. We're going to go way past that. So these are logarithmically spreading infectious diseases, and they're not benign illnesses. Yes, most children recover from measles. I had measles as a child because I was born before there was a vaccine. Most kids recover, but not all kids recover, and some children do die. So we're going to see continued spread of these diseases. Part of the reason why is neighboring state to Texas, Louisiana, their state Surgeon General just passed a rule that said that the Department of Health in Louisiana henceforth cannot encourage or disseminate vaccination, and they cannot hold any vaccine events. They can't do any public education. They can in no way, shape, or form encourage or educate anybody about vaccination. The word vaccination is basically verboten in Louisiana. This is a state that's right next to a state that has a whole bunch of measles cases. We'll see how long before measles leaps into Louisiana. So while we have all these things being done to the country, structure with our public health infrastructure, we are seeing increases in impact on people. More measles, pertussis, avian flu. There's going to be a lot more. This is just beginning. It's been a month, and it's already starting. Just wait. What you're going to see in the next several months, year or two, is a steady increase in rates of contagious infectious diseases, and people will learn the hard way why we implemented vaccination programs back in the 1950s. The United States is falling behind in vaccine. Many countries now have higher vaccination rates than we do, and we are paying the price, and we are going to pay the price. So you asked the question, is your health in danger? I don't know. What do you think?
I think we are in danger. As a matter of fact, the data that I've been getting, Dr. Patmos, and this was just a recent one, is that the life expectancy in Japan is like 84, and the United States is like 76. And they just go through a litany of things that they do in Japan that's so different than the United States. Even where I live in Spain, our life expectancy here is like 82, and the United States it's 76. But we don't have the crazies that they have in the United States. I don't know how else to describe them, but I think you have a crazy movement in that is taken over Washington, D.C. And there was no one except Dr. Cassidy who didn't have the nerve to challenge the current administration's attorney, who knows nothing about medicine, to head up Health and Human Services. And let's just get real. That was just a political payback job. But just because you're paying back politics doesn't mean that's the right person for the right job. So I'm totally against this choice. I've been practicing law for 40 years. I do not pretend to be a doctor, and I do not support a lawyer who's pretending to be a medical expert and heading up Health and Human Services. So I think the American Bar Association and the bar associations around the United States should take a position adverse against this particular person who is now an attorney who's heading up Health and Human Services, who has no medical background whatsoever. But I'm glad that you're on Pod TV discussing these issues, because what they're doing, what's happening is too many people are too scared, too afraid to challenge the current administration. And on this particular issue, I will. There's some issues I agree with them on, but this issue I'm strongly against. That you do not have these anti-vaxxers running around saying, oh, you don't have to do anything, and people like Physicians Against for Informed Consent believe for some reason it's okay that for you or someone else not to be vaccinated and infect somebody like me who's compromised. If you're going to do that, I want you to tell me that you're an anti-vaxxer, so I don't have to hang out with you. Because you can easily infect me, and I do not appreciate that. And if you do, you will be sued, and you will spend the next decade or so in court. If I find you, I will get you, and it will not be fun. I can promise you that right now.
So that's, you raised a very interesting question about the legal implications. Like, for example, now in Texas is the hot spot right now for measles. There's over 50 cases there, and it's spreading rapidly. Texas has a very low immunization rate for measles. One of the reasons why Texas has a low immunization rate is because there's a doctor licensed in Texas who we have talked about on this podcast, who is very vocal and has an enormous global following and an enormous presence on social media, who is advocating against measles vaccination. So here's, my concern. You have patients in Texas who see this Texas doctor on TV, on social media, on Fox News, saying that, vaccination is dangerous. They take his advice. Now, he's not their doctor personally, but they rely upon his advice to their detriment. Then their child gets measles or they get measles, and then there's a consequence. Why doesn't that doctor have liability? If they were your personal physician, if I, as your personal physician, said, don't get vaccinated, and then you get sick and suffer an adverse event, I'm guilty of malpractice. Because we have a physician-patient relationship. But if I go on TV and say, don't get vaccinated, then it's just a matter, then it's called, free speech. We've talked about this before, this concept of detrimental reliance. I can tell you, to all the lawyers out there who might be listening to this program, there are millions of people who are relying on doctors for their advice. And these doctors they're on TV and they're giving incorrect advice. Patients are relying on that incorrect advice to their detriment. And right now, we've not found a way to hold those people, those doctors accountable. You've talked about detrimental reliance. I really believe that is an area that the lawyers need to look at.
Yeah, and I think you're going to see some changes this is ALTA, the American Trial Lawyers Association, which is, by the way, a very aggressive group of individuals. Will start infiltrating and taking on these cases, Dr. Patmos, and you're going to see some changes take place in these anti-vax movement as they are pulled into court. We saw that years ago also with the when they had these OxyContin deals that took place, and the plaintiffs' attorneys eventually got in and basically stopped all that nonsense. I think you're going to see also they're going to come in and stop the anti-vaxxers. It just takes time. I've seen that in my practice where we had really bad actors in the retirement planning area. I went to my actuary several times throughout the years and said, just hold on. The actuaries, they'll get to them. And guess what? They're all out of business today. Every bloody one of them. So here's what my prediction is. And he said, it just takes time. All those anti-vaxxers you're discussing within a decade, they're all going to be out of business. All of them. Because the thing is, they cannot stop the vast majority of evidence against them. It's just the plaintiffs' attorneys haven't figured out how to get to them yet. And once they do, it's going to be over. Because the thing is, they're promoting stuff that, frankly, is a complete lie.
I spent my whole life in education and medical education. I mean, really 50 years since I started college, 54 years ago, 55 years ago. My whole life, over half a century now, has been involved with education, higher education, and public health and so forth. And to think that people, the American public, has been so misled by false information that it boggles my mind. It would have, if you had said 50 years ago that the germ theory, you don't believe in germ theory, you'd have been laughed out of the room. Well, now the Secretary of Health and Human Services is verbally, publicly written in his book, he does not believe in germ theory. He believes in this theory called miasma, which is the environment it's really the environment and the person's.
That whole theory actually comes from ancient Greek mythology, the miasma. Dr. Pappas, I can't believe you would do that. But even Mitch McConnell, I do give him a lot of credit. He voted against the confirmation because the thing is, as he said, I remember polio. Yeah. And the thing is, polio was big. I remember when they finally came out with oral polio vaccines, and people were really into it because there were people there, they were really seriously injured. Even FDR was injured because of polio. Polio was something that was really bad. And to say, hey, we're not going to give vaccines for polio or even the measles, which like one medical doctor on LinkedIn said, well, the measles vaccine has been proven since 1963. So who is this lawyer who is not a doctor, who has a name? Where does he have any standing at all to opine on a medical issue? If I had him in front of a court, which I don't, but if I did, I'd ask him some questions and he would never be certified as an expert witness in a medical matter because he's not an expert on any medical matter whatsoever. So that's part of the reason I object to his nomination, and really object to the people here in Washington, D.C., especially our senators that have no spine whatsoever. So I think, Dr. Patmos, what we really need to do is we need to find a good spinal doctor, neuroskeleton doctor, to go into the Senate and see if any of those people have spines. I don't think they do. If they did, they would stand up. And my second cousin was the Attorney General of the United States, Bill Saxby, under President Ford and President Nixon. And the one thing I must admit about Bill Saxby, at least he had a spine. He stood up to Nixon, stood up to Ford. But the people in Washington, I have no respect for when they don't have a spine, except Mitch McConnell. Actually, give him some credit. He stood up there.
I think it's just a testimony to how much they fear Donald Trump and his ability to retaliate against them. He's got a boatload of money behind him. He can really work to unseat you if you don't support him. And so they're just intimidated and afraid. They don't have a spine, and they don't want to get thrown out in the next election. But this thing about not having qualified people across the board, Trump's health nominations, none of them are qualified. None of them are infectious disease doctors. So for the lay person out there, let me just take a minute. What is an infectious disease doctor? Infectious disease is a subspecialty of internal medicine. In order to be an infectious disease doctor, you have to do an internal medicine residency and then do an infectious disease fellowship, which is 2 or 3 years. Then you're eligible to take the board exam in infectious diseases. It's an analogous pathway to becoming a cardiologist. You start as an internist, then you do a cardiology fellowship, or a gastroenterologist. Start as an internist, you do a gastroenterology fellowship. Fellowship training is what is required to be technically an infectious disease doctor. Infectious diseases are always at the top of the list of the diseases we worry about because they're the ones that kill most people. And so all of the appointees of Trump, none of them are infectious disease doctors. Here's their credentials. Kennedy is a lawyer, has not a doctor at all. Dr. Bhattacharya is an economist. He has no residency, no internship, no fellowship, not board certified, not board eligible, has never had a license, doesn't qualify for a license, no clinical experience, no medical staff membership, no clinical credentials. So he's going to be in charge of the NIH. He's an economist with an MD degree, but an economist, no postgraduate medical education at all. Dr. Oz is a surgeon, was at Columbia in New York, hasn't practiced in years. He's very out of the medical world for a long time. He's been a proponent of herbs and vitamins and so forth, and made a lot of money hawking vitamins on Oprah and so forth. He has no infectious disease training. Dr. Marty Makary is a very fine surgeon. He's qualified to be a surgeon. He doesn't have a fellowship training in infectious diseases. He's not an infectious disease doctor. Dr. Weldon, who's taking over CDC, is an internist like me, but he has no training in infectious diseases. At least I have training in infection control. He doesn't even have that. So you have across the board, what you see are physicians who don't have training in infectious diseases, don't have the proper credentials, who now have oversight of our infectious disease infrastructure. That is a problem. Would you, put non-cardiologists in charge of heart disease? Would you put non-cancer doctors in charge of cancer? Then why would you put non-infectious disease doctors in charge of infectious diseases? It is a complete blind spot about what is an infectious disease doctor. And let me say very clearly, unless you are fellowship trained in infectious diseases, you are not an infectious disease doctor. And by definition, you cannot opine as an expert in infectious diseases. You're entitled to your opinion, but you're not an expert.
Mm-hmm. Yeah, and that's the problem that we're having. And I think individually, everybody is going to be facing this problem in the next 4 years. In other words, this is going to go on for quite some time. And Dr. Patmos, all I can think of is that they need to stay close to their personal physician about their health and stay away from Washington, D.C., because there's going to be no help coming from Washington, D.C., and stay away from some of these crazy social media sites. Now, our social media site, we have a very small reach. 2023, we had 2.3 million verifiable views. We're not even at 1%, but we're getting up to close to 1%, which would be about 3 million. But still, that means there's, in the United States, 300 plus million people that are getting, as you would say, false information, bad information. And frankly, what I think you're going to see is worse information coming from Washington, D.C., is the leadership has no real credentials in health whatsoever, and they're heading up Health and Human Resources. All I can think is you got to stick to your medical doctor and make sure that you consult with them on a regular basis, him or her, about your health, because you're not going to get it from Washington, D.C., that's for sure.
My advice as a internal medicine doctor with added qualifications in infection control: get vaccinated for everything that's appropriate for you based on the current CDC vaccination schedule. Kennedy's going to change that, but as it stands right now, get vaccinated, vaccinate your loved ones, vaccinate your children, make sure you have as much protection as possible. That's my advice. And with respect to misinformation, most people are now getting their information from Twitter or X and Facebook and Truth Social. So these platforms have replaced the New York Times and the Washington Post or the Wall Street Journal. People are now getting their information from Twitter, and we know who owns Twitter. So the information on social media is not reliable, but yet that's where people are getting their information from. We're in for a long, dark road for a while. I think, though, eventually this is all going to blow up. And when people look around and they see their loved ones, their friends and neighbors dying and sick as hell, then they're going to realize that they were lied to.
Yeah. And I think better information rather than Twitter and Twitch is to go to the Mayo Clinic. They have a really good newsletter. The Harvard also has a good medical letter, and so does the Cleveland Clinic. And those three organizations are very good in putting out medical information. And my preference is to get my medical information when I'm reading from Harvard, the Mayo Clinic, or the Cleveland Clinic, not Twitter, Twitch, YouTube, and Facebook, which none of those are experts as well. But with that, we're at the hour, so we do want to thank a board-certified medical doctor, Dr. Michael Patmos, as opposed to, we could have Kennedy on, but he doesn't know anything. So why would we ever have a lawyer on medicine and science? Oh, wait a minute. He heads up the United States Medicine and Science. So I do apologize to all our viewership in China, because we have a big viewership in China and India, that in the United States, they haven't got it right here yet. So hopefully someday it will. And we want to thank Dr. Michael Patmos for spreading the good information about medicine as opposed to what you're seeing out of Washington, D.C. And we'll see you next week on Medicine and Science. Bye-bye.
Thank you.